What we do is called moderate conscious sedation, so we're able to put these patients in a state of comfort, but not so much where they're completely in deep anesthesia.
In addition to the patient's comfort, you also have to consider the caregiver's comfort. So I may do a sedation, but I may be administering far less medication than what is necessary for patients who actually do require it. I do educate caregivers and parents on the fact that nitrous is a type of sedation. It is just a shorter acting sedation, and it only acts while the patient is under the influence. And oral sedation is less predictable than IV sedation, and the amount of medications that we can give, it can all be tailored to the patient. There are some parents, who are absolutely insistent, in which case the first time that they come in, for their comfort, for the patient's comfort, for everyone's comfort, we will sedate them. And then the next time that they come back, if we think, you know what, last time they were really, really great, but I think that we can try it without this time. Why don't we try to give that an attempt? And people, as they get to know you more, they start to trust you more, and you build that rapport. And once you build that rapport, they're more likely to listen to your input and your advice, as opposed to being so hung up on their preconceived notions of what is required. This one and this one, they look pretty good, huh?
We do use kind of a history as a basis and context for what we do, but their behavior or their anxiety is a very fluid situation. So some days, I don't have to do sedation. Some days I do. And for some patients, it's always a sure bet that they need sedation. So I kind of like to gauge, every appointment and see where they stand. As much as sedation makes our job comfortable and cuts down on their anxiety, there's risks to that as well. So we don't want to give it to them unnecessarily.